Hello, my name is Dr. Shana Clark, and I have recently retired from a long career in public sector psychiatry. Why public sector? Because that's where you find poor people, people who have not had a terrific education, and people who have little hope and may have trouble speaking up for themselves. In other words, people who really need a good psychiatrist. Now, what makes me unusual is that at age 22, I fell mentally ill myself. And in the first 10 years of my illness, I was hospitalized 15 times, and I had 3 very serious, requiring intensive care, suicide attempts. Therefore, it is quite remarkable that for the past nearly 18 years, it'll be 18 years the first week in October, I have lived symptom-free. And that's what I hope to, at some point, discuss with you all, because although I don't imagine that anybody would use exactly my method of achieving being symptom-free, you might be able to think up your own, and that would be just wonderful. I should say I was in the 3rd year of Columbia Medical School in New York City when the mental illness first hit me, and I was completely baffled. For the first time in my life, I could not make my mind go and do what I told it to. And so that very day, my first hospitalization started. Columbia insisted that I take a year's leave of absence, and then they said they'd keep my place. But when I came back a year later to go back to medical school, they said, well, since you've been out of medical school for a year, you're no longer competitive. So I went to Belgium, a truly world famous medical school, because they have been training doctors from all over the world for centuries. And there I was the patient of a man who had been the president of the French-speaking psychiatric association worldwide. His pet interest was my disease, and he had a terrific reputation for getting people not only to function in a life, but to be in the life they wanted, which is quite unusual. And when I first saw him and I asked him if he thought I could ever get back to medical school, he said, Mademoiselle, I don't know. The first thing we have to do is get you well. Now, on this side of the Atlantic, all the psychiatrists I had seen spoke about symptom reduction, better control of my moods, but nobody dared say, well. And I think this country is way behind some European countries in this respect. Anyway, I will be having a YouTube show on Mondays called Ask Dr. Shana. And my website is Dr. D-O-C-T-O-R, Shana, SHANA.net. And what you do if you want to ask me a question is go type it in onto my website, and I will answer the question the following week. I should tell you that I will not be making treatment or medication recommendations to anyone. But if you would, because your provider knows you far better than I would after a casual encounter. But if you want help to be able to say to your provider something about your medication in a way that would make him listen and take you seriously, I would be delighted to assist you. Please, when you type in a question, put your first name and also the first initial of your last name. That's in case there are more than one Mary or Jim who type me a question. So, I'm looking forward to having some of you participate in the show next week. There's no time like the present to get started. Okay, see you next week. Bye-bye.